I want to bring in now someone who witnessed the grave situation in Gaza up close. Dr. Thaher Ahmad, Assistant Program Director for Global Health at Advocate Christ Medical Center outside Chicago. He spent 3 weeks in Gaza back in January as part of a medical mission with Med Global, a humanitarian NGO, and is in New York today, by the way, for meetings at the United Nations. Dr. Ahmad, thank you so much for joining us.
Thank you for having me.
Tell me what you saw.
I mean, the situation in the Gaza Strip is catastrophic, and we saw it firsthand. I had been to the Gaza Strip 4 previous times. Med Global, the organization I work with, they've been to the Ukraine, Syria, Egypt, Sudan. This is the worst humanitarian crisis we've ever seen. I mean, it's not just the fact that there are bombs dropping, there are tanks shelling different buildings, and people are on the run. It's that nothing can get in. Food cannot get in for the hungry, medicine cannot get in to treat the patients, and then systematically, one by one, we've seen the hospitals become defunct and inoperable. The hospital that I was at in January, Nasser Hospital, ultimately was under siege, raided, and now it's not functioning anymore. And that was the second largest hospital. It was the largest remaining hospital when I was there. And so this is really a tough situation, and every way you look at it in the Gaza Strip, life has been totally disrupted and damaged.
What were you hearing from the people inside that hospital? What were you seeing of the people inside that hospital?
I mean, it was so tragic. I mean, every single day, because there was such a major military offensive in Khan Yunis at the time, we were getting hundreds of trauma patients. But also, while you're walking, you're bumping into somebody who's been displaced from somewhere. 10,000 people were sheltering in and around the hospital. I mean, I remember walking through the pediatric division and seeing kids playing Ring Around the Rosie while also going to treat people whose legs have been blown off by bombs or by somebody who's now infected from a wound that they suffered a month ago. It just, the dichotomy of seeing those two different things was something I really struggled with. And it's something that every single NGO has been talking about. I mean, these hospitals are overwhelmed. The staff is overworked and not being paid. And this entire time, they're still under the constant threat of attack.
When you think about the children and the women that have lost their lives in the thousands now, and you think about this possible incursion into Rafah, what worries you most, especially when it comes to the resources that the medical community has?
Yeah. I mean, it cannot happen. An invasion into Rafah, an offensive into Rafah cannot happen. It'd be an absolute bloodbath. It'd be a total massacre. We just talked about 13,000 children who have been killed thus far. That number would become astronomically higher than it already is. I mean, 1 in 100 children have been killed in the Gaza Strip since this started. People in Rafah are literally living on top of each other. There is no other space to go. And people should remember, Rafah is the southernmost tip of the Gaza Strip.
Right.
So there's nowhere left for them to go. And the rest of the Gaza Strip is either damaged or destroyed. And so this is something that absolutely cannot happen. And the medical system has already collapsed. The 3 hospitals that are in Rafah are already 300 to 400% over capacity. I cannot imagine what would happen if tanks and ground troops started rolling in.
What is it like for you? You're Palestinian American, you're a physician, you went back to Gaza to help, but now you're back here, sitting in a suit at this desk, going to the UN. What is it like for you emotionally, for other medical personnel emotionally, that go there and then leave others behind?
It's difficult. I mean, there's a tremendous amount of survivor's guilt. I wish I never left Nasser Hospital. I wish I was still there with my Palestinian coworkers, treating the patients. But you know, now that I'm here, I have to live with that, and the thing that I have to do is to try to advocate on behalf of what they're going through. I mean, these are some of the most incredible people I've ever met. They do so much with so little. They're heroes in every sense of the word. And so it's important for me to go to the United Nations and to tell them there needs to be a ceasefire. And not just that. It's not just about getting the bombs to stop dropping. There needs to be aid entering into the Gaza Strip. Food, water, blankets, medicines. We need to get the people what they need. I mean, that IPC report that came out and said that famine is imminent, that 1 in 3 kids in the Gaza Strip are acutely malnourished in the north. We've got to do something about that, and it has to happen in the next couple of hours or days, not weeks. So there's no time. I'm really trying to communicate the urgency.
This is emergent. Dr. Thaher Ahmad, thank you so much for the work that you do and for giving us the time today. Best of luck today.